The ovaries, located on each side of the uterus, are small organs responsible for storing eggs and producing female hormones. Ovarian cancer occurs when malignant cells start to grow in the ovary. It's important to note that cancer that originates in a different part of the body and spreads to the ovaries is not classified as ovarian cancer. Ovarian cancer is a complex disease, and researchers are still trying to figure out exactly what causes it. There isn't one specific chemical in our environment or diet that has been linked to ovarian cancer like with some other types of cancer. However, there are certain factors that can increase your risk of developing ovarian cancer. For example, if you have a family history of breast cancer, colon cancer, uterine cancer, or rectal cancer, your risk may be higher. Additionally, certain gene mutations, such as BRCA1 and BRCA2, can also increase your risk of ovarian cancer, especially if you have Eastern European or Ashkenazi Jewish ancestry. Other factors that may raise your risk of ovarian cancer include obesity, hormone replacement therapy, reproductive history, smoking, and certain medical conditions like polycystic ovary syndrome and endometriosis. If any of these risk factors apply to you, it's important to talk to your doctor about early screening options such as blood tests and pelvic imaging. Early detection can greatly improve the chances of successful treatment. Ovarian cancer is a tricky disease. It's difficult to detect and spreads quickly within the female reproductive system. Since the specific causes of ovarian cancer are not well understood, there aren't many ways to prevent it. If you have a family history of ovarian cancer, your doctor can help you figure out the best way to manage your situation. This may include genetic testing and counseling. In some cases, you may choose to have your ovaries removed as a precaution, which is called a prophylactic oophorectomy. Maintaining a low-fat diet may lower your risk of ovarian cancer, and staying physically active and maintaining a healthy weight can also reduce your risk of many diseases. Other factors that may lower your chances of getting ovarian cancer include breastfeeding, tubal ligation, taking hormonal birth control, daily aspirin use, unless it's for another medical reason, and having a hysterectomy. The chances of ovarian cancer coming back after treatment depend on how far the cancer had spread when diagnosed. For stage I, the chances of recurrence are about 10%. For stage II, it's around 30%. For stage III, it's between 70% to 90%. And for stage IV, it's between 90% to 95%. Now, when it comes to survival rates, these are the percentages of people who live a certain amount of time after diagnosis. Overall, about 46% of women with ovarian cancer live at least 5 years after diagnosis. For stage IA, the 5-year survival rate is 93%. For stage IB, it's 91%. For stage IC, it's 79%. For stage IIA, it's 78%. For stage IIB, it's 73%. For stage IIC, it's 57%. For stage IIIA, it's 59%. For stage IIIB, it's 52%. For stage IIIC, it's 39%. And for stage 4, it's 20%. It's important to remember that everyone's case is different, so these numbers are just a guideline. Your doctor can talk with you about what to expect.